Facing a stem cell transplant can feel like preparing for a significant journey, one filled with many questions and new experiences. It is completely normal to feel a mix of emotions, from apprehension to hope, as you consider this important step in your treatment. A stem cell transplant is a multi-phase medical procedure designed to replace unhealthy blood-forming cells with healthy ones. It typically involves three main stages: conditioning, the actual transplant, and recovery. The goal is to rebuild your blood and immune system, offering a chance for long-term remission or even a cure for certain conditions. The fundamental principle behind a stem cell transplant is to eliminate diseased cells and then introduce healthy stem cells that can grow into new, functional blood cells. This usually begins with a high dose of chemotherapy, sometimes combined with radiation therapy, which is called conditioning. This intensive treatment removes not only the cancerous cells, but also the existing, damaged blood-forming cells in your bone marrow. Afterwards, healthy stem cells are given to you, much like a blood transfusion, and these cells travel to your bone marrow to start producing new blood cells. Your journey will typically start with a thorough evaluation to ensure you are well enough for the procedure. Following this, you will undergo the conditioning phase, which is an intense treatment period lasting several days. The transplant itself is usually a single-day infusion of the stem cells, which is often described as feeling similar to a regular blood transfusion. After the infusion, you will enter a critical recovery period, often lasting several weeks in the hospital or a specialized outpatient unit. During this time, your medical team will closely monitor you for side effects and watch for signs that the new stem cells are engrafting and starting to produce blood cells. There are two main types of stem cell transplants: autologous, using your own previously collected stem cells, and allogeneic, using stem cells from a donor. An autologous transplant often means a shorter recovery from a new immune system, as your body is receiving its own cells. An allogeneic transplant, while potentially offering a stronger immune response against the cancer, requires careful donor matching and carries a higher risk of complications like graft versus host disease, which is when the donor cells attack your own healthy tissues. Understanding which type is planned for you will help clarify the specific recovery challenges and monitoring you will experience. Ultimately, undergoing a stem cell transplant is a profound process focused on restoring your health. While challenging, the detailed preparation, careful medical care, and dedicated recovery efforts are all geared towards equipping your body with a renewed ability to fight disease and thrive, paving the way for a healthier future.